I am pleased to make a contribution on the Dental Benefits Amendment Bill. This bill implements a budget measure from last year, the guaranteeing Medicare changes to the Child Dental Benefits Schedule. This bill amends the Dental Benefits Act 2008 to remove the lower eligibility restrictions of 2 years to allow eligible children from 0 years of age to access the Child Dental Benefits Schedule. This is a sensible reform and Labor supports it. And I note that it is estimated that each year an extra 300,000 children aged between 0 and 2 will become eligible for the program from the 1st of January 2022, and that 15% of children in this newly eligible age group with teeth issues will access the scheme. Obviously, if any dental issues in a child need to be addressed, the sooner they are dealt with, the better. In speaking on this bill, I want to draw to the attention of the House the Child Dental Benefits Schedule, introduced by the Gillard Labor government in August 2012, which was part of Labor's dental health reform package. The package was comprised of the $1.3 billion National Partnership Agreement for Public Dental Services, a $225 million flexible grant program, and $2.7 billion for the CDBS, which replaced the Chronic Disease Dental Scheme and the Medicare Teen Dental Plan. Although these reforms may not have been headline-grabbing at the time, they do constitute a serious and progressive public health policy reform, which has always been the hallmark of Labor governments. Since the Gillard government implemented this reform, it's provided over $2.3 billion in benefits and delivered more than 38 million services to over 3 million Australians. Almost invariably, when I meet with constituents, health is the issue that is often always raised as being of fundamental importance to people. In our great Australian social democracy, access to health care based on need and not ability to pay for the treatment is something we are rightly proud of and cherish. I do regularly receive feedback from constituents about dental health and difficulty in getting treatment for particular conditions, so this bill is a welcome addition to the care provided under CDBS. Labor is supporting the government's bill because it does build on a great Labor health reform and is an extension of Labor's legacy in health policy. And in speaking on the bill on health policy, I want to draw to the attention of the House the overwhelming response I've received to my Medicare petition regarding the government's recent attacks. Government members should be very concerned about the feedback I have received. These are some of the things my constituents have told me. I can't repeat some comments about the Prime Minister, as I certainly would be ruled as unparliamentary, but in their comments my constituents clearly identify how much they care about Medicare. And I quote, "Stripping essential medical services to ordinary Australians should not be allowed. Otherwise we'll end up like America, where people can't afford medical treatment. Medicare is vitally important to all Australians. It gives a sense of safety to those who cannot afford private health insurance." Another one, "Australia's universal healthcare system is revered by many people around the world who cannot afford life-saving and life-altering healthcare. The Liberals' attempts to transform this system into a money-making machine is deplorable." Another one, "This government doesn't care about any of us, especially those who are struggling and can't afford doctors' fees." Another one, "Our health is our wealth." And another one, "Medicare is sacrosanct, hands off." And finally, Simone from Redhead makes a point that I've often made in this place. If people can't afford to go to their doctor, their health will get worse and will end up putting a strain on our already overworked hospital system. There are just some of the comments from my constituents about their passionate support for Medicare and their commitment to a fair and equitable health policy in this country, which this bill builds on, Mr Deputy Speaker. This bill is an important addition to the dental health reforms that Labor put in place because they're important health reforms, health policy that benefits all Australians. And I want to emphasise that this bill, the Dental Benefits Amendment Bill, is welcome reform and supported by Labor, but the Liberal and Nationals' ongoing attacks on Medicare are not. And let's not forget we're in the middle of a global health pandemic and the government is rushing through changes to Medicare that the AMA has warned will drive up the cost of some surgeries. Many of our colleagues cannot be here because they are in lockdown at home, and since coming to Canberra last week, the whole of Shortland is now in lockdown. And in fact, I just heard some 40 minutes or 35 minutes ago that the New South Wales Premier has extended the Hunter lockdown by another week. And quite frankly, given the number of cases, while I'm no medical expert, I'll be very surprised if we exit lockdown anytime soon, Mr Deputy Speaker. But let there be no mistake where the fault for this lockdown lies. It lies with the Prime Minister and his government. Australia is an international joke because of our vaccine rollout, but it's no joke for the teacher or the cleaner or the truck driver or the aged care nurse, all who are on the front line, all essential workers who constantly contact my office because they cannot get an appointment to be vaccinated. And in fact, the biggest numbers of COVID cases in my community is an outbreak of COVID at a aged care home at Edgeworth, the Hawkins Masonic Village. And it's been established, and I just heard it today, that those cases, I think it's 12 residents and at least 3 staff, was caused because an unvaccinated aged care worker was there and infected the other people. Every single aged care worker was supposed to be vaccinated by Easter. They were at priority 1A rollout from this government. Mr Morrison has failed my residents with that rollout. The fact that aged care workers, at least half of aged care workers, aren't vaccinated, the fact that they are still having to go to work, and the fact that if they catch COVID, they are then very likely to pass it on to our vulnerable residents of aged care homes, lies at the feet of this government and Mr Morrison in particular. And that's the context for this bill, which is all about health. And what rubs salt into the wound of the current lockdown is the fact that my constituents see the Prime Minister and the Premier of New South Wales on the television every night repeating ad nauseum that the way out of lockdowns is through vaccination. Well, my constituents had their appointments cancelled because the New South Wales government stole our Pfizer vaccines and redirected them to Sydney. And my constituents and myself are absolutely furious about this. And why were they redirected? Because the Prime Minister failed to get enough Pfizer into Sydney and still continues to fail to get Pfizer into Sydney. The New South Wales government's actions are a disgrace. They should be condemned. They should not be stealing Pfizer vaccine from the Hunter and Central Coast while we have outbreaks, but they were forced to do this because the Prime Minister failed to provide sufficient vaccines to Sydney. The Prime Minister said in the House last week that those doses would be sent back, but I'm still receiving multiple reports that people who had their appointments cancelled have not had them rescheduled. One constituent emailed me about his daughter's experiences. He writes, "My daughter was booked in at Belmont for the vaccination and was advised that her vaccination had been cancelled and given to high school students in Sydney at a private school. She was told she would receive another appointment. Her original appointment was the day after the vaccine was sent to Sydney. She made contact with the booking service and was told bad luck. The government's decision to give the vaccine to the wealthier Liberal Party seats is a disgrace and un-Australian, and something that should be exposed and not forgotten." Unquote. End quote, rather. This is just a taste of what I'm seeing in my community about health policy and, in particular, Liberal government stealing vaccine from my region, a region that's now got a very significant COVID outbreak, a region that had COVID in the community, known cases on the northern Central Coast, serviced by the Belmont vaccine hub when the Liberal governments stole our vaccine. And so, Mr Deputy Speaker, it's important context for this bill. In speaking on the dental benefits bill, it's also relevant to provide feedback from an actual dentist. Gwen from Belmont has a dental practice and contacted my office yesterday. Her business is suffering incredibly because of the lockdown, as she can only perform emergency procedures and she's not eligible for any state government business assistance. Gwen is also absolutely clear who is responsible for the lockdown that is so damaging her livelihood: the Prime Minister and the Premier of New South Wales. This is the feedback I'm receiving from my constituents daily because of lockdown, and that's the context for the debate we're having right now. Other aspects of health policy that this bill is relevant to is the attack on bulk billing in my community. This bill goes to the affordability of dental care, and obviously that's very important, but the affordability of general health care is also very relevant to this debate. And families in my electorate have been slugged by increased costs of going to a GP because this government has ridiculously reclassified my region as a major metropolitan region akin to Double Bay in Sydney. That means that they have cut the payments that doctors in the Central Coast and Hunter receive for bulk billing, and that has had a dire impact on many surgeries. Well, one surgery told me that they've gone from bulk billing 80% of their patients to bulk billing 20%. That is having an enormous impact, and I have families who are literally choosing between putting dinner on the table and going to the doctor. That is unacceptable in Australia. That is unacceptable in Australia in the year 2021, that people are being forced to make that choice. But that is just one of the many examples of this government's attack on health policy and healthcare in this country. Another is a separate but related reclassification of the Hunter and Central Coast in terms of doctor shortages. Means we're now treated the same as the eastern suburbs of Sydney, that somehow we've got a surplus of doctors. And that means GP surgeries in my electorate and nearby don't get incentives. Doctors don't get the points they get from serving in places like Dubbo or Tamworth, which means my GP surgeries are finding it incredibly hard to attract GPs. They are literally struggling to staff their GP surgeries. And I had the head of the Lake Memorial surgery contact me about this recently. He's having enormous difficulty finding doctors. So if you get to a doctor under this government, you're paying more than you've ever had before, and that's if you find a doctor, because under this government it is incredibly hard to get on the list for a new GP appointment, to see a new GP. So this dental health benefits bill really should be seen in the broader context, which is multiple attacks by this government on healthcare, whether it's on GP shortage through their reclassification, whether it's on bulk billing through their reduction in the bulk billing incentive, whether it's on the attack on the Medicare benefit schedule that the AMA and Grattan Institute have said will increase the out-of-pocket costs for people having surgery. These are all attacks on the health of my constituents. And that's made worse because of the current COVID crisis. COVID crisis where this government has failed Australians and failed my community. I am so furious with the incompetence of the Morrison government. This government has failed in the national quarantine system that allowed 27 outbreaks, including the one that started the eastern suburbs cluster. Then the New South Wales Premier, to pander to the wealthy eastern suburbs, was too weak to lock it down when she had the opportunity. She was egged on by the Prime Minister, who 9 days into the Bondi cluster congratulated her on not locking down. That COVID outbreak then spread to Western Sydney and the Central Coast and then up to Hunter because there wasn't sufficient vaccine available throughout New South Wales and Australia. And then the New South Wales Premier stole the Central Coast and Hunter's Pfizer vaccine because she couldn't get sufficient COVID doses to Western Sydney. So this attack on the health of all my constituents in the lockdown is just the latest example of this government's contempt for health policy in this country. So before I commend this bill to House, I just want to say that this likely will be my last opportunity to speak in the chamber for some time, as my home region will still be in lockdown probably in the next sitting fortnight. I'll be travelling home tomorrow to start the joys of homeschooling and to be part of the lockdown with my community. We'll continue to do our welfare calls for my constituents. We've managed to contact over 1,500 houses in the last 2 weeks to just check on them. And I want to say to my constituents, thank you for following the rules. Thank you for doing the right thing. Thank you for bearing with the incompetence of the Morrison government that's caused you to be in lockdown right now. If my office can assist in any way, whether it's income assistance payments that this government has resisted, whether it's access to food banks and charities, or referrals to mental health services, please contact my office. We are still operating remotely during this difficult period. But I just want to let my constituents know that I stand with you. This is a really troubling and hard period, but we will get through it. But we are in this present situation because of the appalling incompetence and arrogance of the Prime Minister and the Liberal and National parties. They have failed the people of Australia, who are now suffering the health and economic consequences because of the ineptitude and mendacious behaviour of this government.